Hello, this is a case presentation of a SOAP analysis for a patient with diabetic neuropathy. And our presentation was done by a collaboration between a pharmacy student, which is me, Amani Alshehri, and a physical therapist, Nicole.
Hello.
The presentation objective will be providing an overview of the patient's history and patient subjective overview, discussing the objectives, information, and also assessment of the patient. We also would like to discuss the plan of care for the patient.
For the patient history, the patient is a 59-year-old male, and his main medical history that we're going to focus on is type 2 diabetes, specifically diabetic neuropathy. He also has hypertension and dyslipidemia. The patient recently noticed tingling and numbness in both of his feet, and there is a tiny blister on the right foot on the second digit immediately. So we want to look at the different wounds that he's had recently.
For the subjective information, our patient has a medical history, neuropathy 5 months ago, and hypertension 5 months ago, diabetes 4 years ago, heartburn 4 years ago, depression more than 5 years ago, and a history of cataract removal 1 year ago. Patient has a major history of stroke, a major family history of stroke, diabetes, hypertension, and glaucoma. He works in an office. He stopped following his case with the physician for 2 years. Patient doesn't practice any physical activity and also doesn't follow any dietary management. He stated that he noticed recent numbness, tingling, and wound in his feet. He mentioned that he had an experience of uncomfortable muscle ache after using simvastatin ezetimibe combination. These are the information that I got during the interview.
From a physical therapy standpoint, our main focus during the interview was on his numbness and tingling and the wound that he had found on his foot. And it's also important that he does not participate in physical activity right now, so we would want him to start that to help with his management of diabetes.
For the objective information, the patient has 2 lab results, one about 6 months ago and the other one is like 6 days ago. The previous laboratory data that were collected in February 1st was that the patient has an elevated urine microalbumin and creatinine ratio. It was 38. And also has elevated cholesterol level, elevated triglyceride, elevated total cholesterol, and elevated fasting blood glucose level. It was 125, and the percentage of the A1C was elevated. It was 7.9. His recent lab results show that the LDL is normal. It's 97.2, and the A1C level, it's still elevated as 8.7%. We would like the patient to do a lab result for his urine microalbumin and creatinine ratio since it's not showing in his recent lab result.
From a physical therapy standpoint, for the objective input, we would want to inspect the wound. We would want to look at the size, the depth, and the color of the wound, and we would take measurements to document to see through the term of the treatment to see if there's improvements. For sensation testing, we would do monofilament testing to see if there is a protective sensation or if there is a possibility for more wounds and where they are on the foot. And we would want to include patient education on diabetic neuropathy and the importance of checking his feet every day, and possibly talking to a podiatrist for him to see a couple times a year, so this might lead to another referral.
For the assessment, AB is a 59 years old patient who has a history of diabetes, dyslipidemia. He was recently diagnosed with microalbuminuria and hypertension as a result of diabetes. After his recent visit, irbesartan 150 mg was added to his medication to manage his microalbuminuria and hypertension. His blood pressure and lipid profile is well controlled right now. His A1C is still elevated and need to be managed closely to prevent any other long-term complication related to his uncontrolled hyperglycemia. AB has stated that he started feeling recent numbness, tingling, and noticed wound in his feet, which indicate adding a drug that minimizes those symptoms. AB also needs to conduct an annual foot exam and further follow-ups with a physical therapy specialist. And AB has a history of changing his dose of metformin. This may contribute to his improperly controlled blood glucose level. A special education about the purpose of each drug and the importance of following his prescribed regimen during counseling session is essential. For example, diabetes self-management education. AB's A1C is progressively increasing, and special pharmacologic and also non-pharmacologic intervention should be considered. For example, adding basal insulin and recommending physical exercise and dietary modification.
To add on to that, the clinical impression at this time for the physical therapist standpoint is that it would be an ICD-9 code of diabetic neuropathy, which would be 707.1, and we would focus on the preferred practice patterns that include the integumentary system, including 7A, which is primary prevention, risk reduction for the integumentary disorders, and 7B, impaired integumentary integrity associated with superficial skin involvement.
For the plan, the goals of therapy from a pharmacy perspective is that we would like an adequate glycemic control for both A1C and fasting blood glucose levels, and also improving the quality of life for the patient and preventing any long-term complications of diabetes, either micro or macrovascular complications and infections. We also would like to prevent and manage the progression of current comorbid conditions like diabetic, neuropathy, hypertension, and microalbuminuria, minimize any drug-related adverse event or adverse drug reactions, and prevent hypoglycemia in the future, decrease the numbness, the tingling, and improve feet health.
The goals that would be focused on in physical therapy would be focusing on the wound inspection, again, the size, shape, depth, and the color documented. We would want to see an improvement both in granulation tissue and also a decrease in the size of the wound. And we want to see how the wound is affecting gait and balance, because this could lead to possible gait abnormalities or balance problems, and we don't want fall risk to be another problem to add to our list. So we would do some balance testing and the importance of patient education. So we would want to inspect the feet every day, and this is really important to see if there is like a rock in the shoe. This could cause more wounds. So important things to consider is blood pressure before and after activity, the blood glucose levels before activity, during, and after, and whether or not the patient ate food before they came to therapy or took medication before they came to therapy, and how much this is going to affect our therapy treatment.
To achieve our goals, a pharmacologic plan has been constructed. From a pharmacy standpoint, the patient A1C is not controlled, and adding basal insulin glargine, at a dose of 10 units subcutaneously at night, daily, and then we would like to check the A1C 3 months to monitor insulin effectiveness. Continue the use of anti-dyslipidemia and anti-hypertension medication, since they are effectively controlling the patient dyslipidemia and hypertension respectively, and will also improve the patient overall health. For the patient tingling and numbness, we would like to add pregabalin 50 milligrams 3 times daily to manage neuropathy.
The recommended plan of care for physical therapy would include the patient education, the diabetes education, so this would include sensation, blood glucose levels, and the importance of exercise, and a daily inspection of the lower extremities to make sure there's not new wounds. We would also want to include therapeutic exercises and therapeutic activities because exercise is important in the management of diabetes, and we would want to include balance and neuromuscular re-education to make sure that balance is not becoming an issue and we don't want him to become a fall risk at any point in time.
The non-pharmacologic plan will be as follows. Patient is not currently following any dietary restriction. A follow-up with a dietitian is recommended to help control his glucose blood levels. Patient is not practicing any physical therapy, and we would like the patient to have at least 30 minutes exercise 3 times per week to help decreasing A1C and minimize any cardiovascular disease risks. Discuss the benefit of smoking cessation. Smoking cessation may be associated with decreased risk of cardiovascular complications, hypertension, and the most importantly is microvascular complications which the patient is suffering from. Advise the patient to be up to date with his vaccination recommended for diabetic. For example, pneumococcal vaccinations, hepatitis B virus vaccination, and influenza vaccine. For the monitoring parameters, to monitor the efficacy of the treatment, we would like to assess glucose level during the day after starting insulin and also A1C every 3 months to evaluate the effectiveness in decreasing the blood glucose level. Also, we would like to have decrease in numbness and tingling and improve in wound healing. For the toxicity, we will focus on the 2 newly added medications, which are insulin and pregabalin. For insulin, the toxicity involved is hypoglycemia, and for pregabalin, the toxicity involved is peripheral edema, weight gain, and vision change. For the follow-up, we would like to follow the patient 3 months after starting insulin to evaluate the effectiveness of pharmacologic and non-pharmacologic intervention. And for tingling, numbness, we would like to follow the patient 1 week after starting pregabalin to see the effectiveness and to see if there is a need for any dose adjustment. Patient education. We would like to emphasize that keeping your blood glucose level controlled may prevent diabetes complications such as chronic kidney disease, foot amputation, vision problem, and improvement in wound healing in the feet. Take your drugs at the same time every day. Make sure that your insulin is clear and has no particles before injection. Drugs used to treat increased glucose may also cause severe decrease in blood glucose level in the body. Pay attention to some symptoms like headache, weakness, shaking, increased heartbeats, and sweating. Once you feel those symptoms, try to take anything that has glucose in it, like juice, sugar, glucose tablets, or glucose liquid.
Thank you for listening to our presentation. I think this collaboration between the pharmacy point of view and the physical therapy would be great for this patient and help him out with his health and his diabetic neuropathy.
It was a great time to construct this SOAP analysis and wish you liked it and enjoyed it.